Microdermabrasion is where I heavily exfoliate the skin with a machine that actually has cute little diamond crystals on the top of it. So for lack of a better term, it's kind of like sandblasting the skin and really sloughing off or getting rid of that top layer of skin that's just kind of hanging on for dear life. Microdermabrasion has just a little bit of some exfoliation when we begin our cleansing process. The chemical exfoliation that comes in is from the toner that we use. So it kind of helps to get rid of the glue that's hanging onto the dry, dead skin cells. We then go in with a micro polish and kind of lightly exfoliate the skin, kind of warm up the skin, move that lymphatic system. And then from there, once the skin is nice and dry, I go in with the machine and with a diamond tip and really go back and do actually what's called raking in certain motions, move the skin in a certain way so we can kick off any dry, dead skin cells. From there, it just depends on how much layering a patient has, how many laps I actually do across the face. You can go across the neck. It's a little bit more of a delicate area, but it is an area that we can do. It's just a great way to get very glowy, dewy skin. It's something I always recommend doing before a big event, wedding, class reunion, anything like that. Get your skin nice and prepped and ready so that makeup lays like a dream, or if we're getting little bumps from like razor burn for gentlemen, it's a great way to exfoliate so that we're not getting those razor burns anymore. So make it something, I think, in Michigan that should always be done seasonally. Our skin changes quite a bit when we add a bunch of moisture to the air or lose a bunch of moisture, and we get that wonderful dew point and humidity, and our skin rapidly changes and we feel layered up. So getting in the habit of doing it at least every 3 months when we get those big shifts in the weather, your skin will change tremendously. Just that 3 to 4 times a year, you'll see a huge difference in your skin. Combining it with certain products obviously is going to make, it's going to stretch the length of that service that after having it done, or even before it's done. Making sure that your skin, is as healthy as you can make it at home, and then coming in, having it done, and then continuing the health of that skin with certain products. It allows your product to work fantastic afterwards because you're not trying to hydrate dry, dead skin. It's kind of like trying to water a dead plant. Like, it's not going to do anything. So a microderm is a great way to also make sure that your products are working properly, so that they can actually penetrate and get to where they need to get to. So it's probably one of my favorite services to do because a patient will walk out of here feeling fantastic. Right after, I do apply a tinted sunscreen, depending on who's walking out the door. The skin may feel a little tight, maybe a little bit irritated. It's nothing further than about 12 to 24 hours. So the next day, you'll literally wake up and skin is going to it's going to feel like a dream. It's going to feel as smooth as it ever has. It's going to feel nice and rehydrated. You'll wake up, no downtime. So it's kind of awesome. I do always encourage lots of water drinking after having one of these done, because the amount of raking that I'm doing with the machine across the skin, we're moving a lot of lymph. We're doing a lot of deeper massage because of the vacuum. So detoxing the skin, helping the skin detox itself with a bunch of water that day. So having enough water within the layers of your skin allows the products and allows a microderm to do its job. Typically at other places, you'll have the microderm done, we'll do the diamond tip and then put a little lotion on you and kick you out the door. Here we take it a couple steps further and we actually use our own signature line biocellulose mask, and or a couple of masks from SkinCeuticals, depending on what your skin or how your skin reacted and what your skin needs. You'll leave here with a little bit of a mask on as well. So kind of get 15 minutes of chill time and relaxation and rehydrate that skin and put back in the ingredients that should be in your skin, take down any redness or irritation, and then you go on about your day, so you're not walking out of here with flame on red skin. You can add a microdermabrasion in with like a customized facial. That way you can do kind of a pre-mask or like a micro polish mask, do the microdermabrasion, do a mask afterwards, incorporate a steamer. It is something that can definitely be done before doing a microneedling or a laser. It will get your skin to its optimum health before doing a bigger service. So yeah, it can be combined and mashed in with darn near every service that we do here. And there are certain skin conditions that wouldn't be particularly like the best to do. If someone had even just a light eczema across the face, obviously anybody with rash or anything like that, acne can actually really get inflamed if you do microdermabrasion. If you break open a pustule or anything, you're just going to spread that bacteria. That is the last thing we want to do in the aesthetics world. There's certain levels of acne that can really get irritated, but that being said, if I have a patient who has acne who is using certain products that's topically drying the skin out, all we're doing is layering it up. So having somebody come in for a microderm to make sure that their products are working better, especially acne products, it is something that we can do. I just lessen the amount of suction or vacuum that's on the machine itself. Injectables, there's a little bit of leeway there. You definitely want to give me at least 2 weeks, 1 to 2 weeks. It depends on how much was injected as far as your toxins. So there's a little bit of leeway there, but there's nothing that, you know, Doc and I have multiple times had a patient come in, had a microderm done, optimal skin, and then walked into her room and had an injectable done. So as long as they're in the right position, we can definitely set you up with where you're in and out the door in one setting and having both services done. I can guarantee that once you've had one done, you'll go to apply makeup or even just a moisturizer in a couple of weeks after having one, and you'll start to feel those layers and be like, okay, time to call Lisa, like we need to get back in there. So yeah, it's just something where it's easy. You're in and out the door in about 45 minutes, so skin's feeling nice and healthy. So come on in.